Mental health is an integral part of overall well-being. It affects how individuals think, feel, and behave. Unfortunately, mental health disorders are prevalent, impacting millions globally. This underscores the crucial role of mental health nurses in providing specialized care. These nurses work tirelessly on the front lines, offering support, treatment, and advocacy. They work in various settings, including hospitals, community clinics, and private practices. Their scope of practice includes conditions like depression, anxiety, bipolar disorder, schizophrenia, and substance use disorders. They are committed to providing holistic care that considers the physical, emotional, social, and spiritual needs of their patients. This patient-centered approach fosters a therapeutic relationship built on trust, respect, and empathy. Their unwavering commitment to high-quality care makes a profound difference in the lives of individuals, families, and communities. In healthcare, evidence-based practice, EBP, is a cornerstone of delivering safe, effective, and patient-centered care. This approach integrates the best available research evidence with clinical expertise and patient values.
For mental health nurses, EBP guides their decision-making and actions in daily practice. EBP ensures interventions are grounded in sound scientific evidence.
This means staying abreast of the latest research findings and applying this knowledge to clinical scenarios. By embracing EBP, mental health nurses can confidently select the most appropriate interventions. EBP leads to improved patient outcomes, reduces variations in care, and promotes efficient use of healthcare resources.
EBP fosters a culture of continuous learning and improvement within the nursing profession. It encourages nurses to question assumptions, seek new knowledge, and critically evaluate their own practice.
Despite challenges, the benefits of EBP make it indispensable for mental health nurses striving to provide the highest quality of care. This guide is an invaluable resource for nursing students and professionals, providing a solid foundation in evidence-based mental health nursing practice. It equips readers with the knowledge, skills, and confidence to deliver exceptional care. We will explore the multifaceted world of mental health nursing, delving into the foundational sciences. From biology and psychology to pharmacology and neuroscience, readers will gain a comprehensive understanding of the factors influencing mental health. The guide will explore essential concepts of research and evidence-based practice. Readers will learn about different research methodologies, statistical analysis, and the critical appraisal of research articles. Practical examples will illustrate how to translate research findings into clinical practice. Ethical and legal considerations, patient-centered care, and interprofessional collaboration will be explored in depth. By embracing lifelong learning, mental health nurses can ensure their practice remains current, evidence-based, and responsive to evolving needs. Mental health is deeply rooted in the biological realities of our bodies. The brain, hormones, and overall health contribute to our mental well-being.
Understanding these biological underpinnings is crucial for mental health nurses. Neurotransmitters regulate mood, sleep, and cognition.
Imbalances in neurotransmitters can contribute to conditions like depression, anxiety, and schizophrenia.
Hormones also influence mood and behavior. Imbalances in cortisol can contribute to anxiety and depression.
Chronic physical health conditions can impact mental health, increasing the risk of mental health challenges.
Understanding the biological basis of mental health empowers nurses to provide comprehensive care. This knowledge addresses not only psychological and social aspects, but also underlying biological factors.
Section 2. Psychological frameworks in mental health. Psychology provides the framework for comprehending thoughts, feelings, and behaviors. Psychological theories offer valuable insights into the human mind and behavior. The cognitive behavioral model suggests that distorted thinking patterns contribute to emotional distress. Cognitive behavioral therapy, CBT, helps individuals identify and modify negative thought patterns. Psychodynamic theory emphasizes unconscious processes and early childhood experiences. Humanistic psychology focuses on human potential and personal growth. Mental health nurses can tailor interventions to meet the unique needs of each patient. By understanding the interplay between thoughts, feelings, and behaviors, nurses promote mental well-being and recovery. Section 3. Pharmacology, the role of medications. Psychotropic medications have revolutionized the treatment of mental illness.
Mental health nurses require a solid understanding of these medications. Antipsychotic medications manage symptoms of psychosis by blocking certain neurotransmitters.
Antidepressant medications treat depression and anxiety by increasing levels of mood-regulating neurotransmitters.
Mood stabilizers manage mood swings in bipolar disorder. These medications require careful monitoring due to potential side effects.
Mental health nurses play a critical role in ensuring the safe and effective use of psychotropic medications. Their responsibilities include administering medications, monitoring for side effects, and educating patients. By understanding psychopharmacology, nurses optimize medication regimens and maximize therapeutic benefits. Section 4. Neuroscience. Unraveling the brain's mysteries. Neuroscience offers a glimpse into the intricate workings of the brain.
The brain, composed of billions of neurons, serves as the command center for our body. Neurons communicate through electrical and chemical signals.
Research has identified specific brain regions involved in mental health conditions. The amygdala processes emotions, particularly fear and anxiety.
The hippocampus, involved in learning and memory, is linked to depression. Chronic stress can lead to shrinkage of the hippocampus, impairing memory. Understanding neural pathways guides the development of targeted interventions.
Mental health emerges from a complex interplay of biological, psychological, and social factors. This biopsychosocial model recognizes that these factors are interconnected.
Mental health nurses provide comprehensive care by addressing these multifaceted challenges. Genetic predispositions influence vulnerability to mental health conditions.
Environmental factors, such as childhood experiences and social support, interact with genes. Psychological factors, like personality traits and coping styles, shape mental health. Social factors, including social support and socioeconomic status, contribute to mental well-being.
Mental health nurses address psychological symptoms and explore social determinants of health. This holistic approach enhances resilience and promotes mental well-being.
Research is the compass guiding mental health care towards effective interventions and better patient outcomes. For mental health nurses, mastering research methods is essential for evidence-based practice.
Nurses must be skilled in research methodologies to evaluate evidence and contribute to their field. Research methods include quantitative and qualitative approaches.
Quantitative research quantifies phenomena and tests hypotheses. It involves numerical data collection through surveys, experiments, or statistical analysis.
Qualitative research explores human experiences through interviews, focus groups, or observation. It gathers non-numerical data to understand the meaning and context of experiences.
Mixed methods research combines quantitative and qualitative approaches for a comprehensive understanding. Understanding research methods helps nurses evaluate evidence and tailor patient care. Statistics, often perceived as a daunting realm, serves as the bedrock of quantitative research, providing tools to analyze data and draw meaningful conclusions.
For mental health nurses, understanding key statistical concepts enables them to interpret research findings and make informed decisions about patient care.
Central tendency describes the typical value of a dataset. The mean, median, and mode are common measures.
Variability describes the spread of data points. Measures like range and standard deviation provide insights into data consistency.
Statistical significance, often expressed as a p-value, indicates the likelihood that an observed effect is not due to chance.
Grasping these concepts helps mental health nurses critically evaluate evidence and make informed decisions about patient care. Section 3. Critical appraisal. Separating wheat from chaff. In the vast and ever-expanding landscape of research, not all studies are created equal.
Just as a jeweler scrutinizes a gemstone, mental health nurses must develop the skills to critically appraise research studies.
Critical appraisal empowers nurses to determine the trustworthiness of findings and their applicability to practice.
Assessing the validity of a study is crucial, ensuring its design reflects the truth.
Internal validity addresses potential biases, while external validity examines generalizability.
Reliability refers to the consistency and reproducibility of the study's findings.
The applicability of research findings to clinical practice is paramount for evidence-based nursing.
By honing critical appraisal skills, mental health nurses become discerning consumers of research.
This ability is essential for making informed decisions about patient care, ensuring interventions are grounded in the best available evidence. Section 4. Bridging the gap from research to practice. Research must be translated into real-world clinical practice to benefit patients.
Bridging this gap is crucial in mental health nursing. It requires disseminating research findings and implementing evidence-based interventions.
This ensures research informs and enhances bedside care.
Disseminating research is the first step.
Nurses can share research through journals, conferences, and training sessions.
This fosters a culture of evidence-based practice.
Implementing evidence-based interventions requires integrating research into clinical protocols.
This may involve developing new policies and providing training.
For example, a new protocol for managing dementia agitation.
Evaluating interventions ensures desired outcomes and identifies improvements.
This involves collecting data on patient outcomes.
Continuous monitoring allows for adjustments to optimize practice.
Mental health nurses play a pivotal role in translating research into practice.
This leads to improved patient outcomes and a more efficient healthcare system.
Section 5. Ethical considerations in mental health research. Mental health research navigates a complex ethical landscape.
The sensitive nature of mental health conditions, the potential vulnerability of individuals with mental illness, and the stigma often associated with these conditions necessitate a heightened awareness of ethical considerations.
Upholding ethical principles is paramount to protect the well-being and rights of research participants, and to maintain public trust in mental health research.
Informed consent involves providing clear, comprehensive, and understandable information about the study. Ensuring informed consent in mental health research can be particularly challenging.
Researchers must carefully assess the capacity of potential participants to understand the study and make voluntary decisions about participation. Confidentiality involves protecting the privacy of research participants. Researchers employ various methods to protect confidentiality.
Beneficence, the ethical principle of maximizing benefits and minimizing risks, is paramount in mental health research.
Researchers have an obligation to design studies that generate meaningful knowledge and improve lives while minimizing harm.
By ensuring informed consent, maintaining confidentiality, and prioritizing beneficence, nurses contribute to a culture of ethical research.
Evidence-based practice faces many challenges, especially in mental health. Barriers include resistance to change, lack of knowledge, and limited resources.
Overcoming these requires effective communication, education, and leadership.
Engaging stakeholders fosters buy-in and successful implementation.
Providing education and support empowers nurses to adopt evidence-based practices.
The landscape of mental health research is in a constant state of flux, shaped by scientific advancements, technological innovations, and evolving societal perspectives on mental illness.
This dynamic nature necessitates an ongoing commitment to staying abreast of the latest developments.
One notable trend is the increasing emphasis on personalized medicine, tailoring treatments to the unique characteristics of each individual.
This approach moves away from the one-size-fits-all model of care.
Advances in genetics, neuroscience, and data analytics are paving the way for more personalized interventions. The essence of nursing lies in the art of applying scientific knowledge with compassion and empathy.
In mental health nursing, this integration is crucial.
Mental health nurses translate scientific knowledge into practice, tailoring interventions to meet unique patient needs.
Assessment exemplifies this integration.
Comprehensive assessments, guided by empathy, provide a holistic understanding and guide individualized care plans.
Mental health nursing, operating at the intersection of science, law, and ethics, demands a keen awareness of the ethical and legal considerations that guide practice. The sensitive nature of mental health conditions, the potential vulnerability of individuals with mental illness, and the stigma often associated with these conditions necessitate a steadfast commitment to upholding ethical principles and adhering to legal mandates.
One fundamental ethical principle in mental health nursing is respect for autonomy, which recognizes the right of individuals to make their own decisions about their healthcare, even if those decisions are not aligned with the nurse's professional judgment. This principle is particularly relevant in mental health care, where patients may have varying levels of capacity to make decisions due to their illness.
Nurses must carefully assess decision-making capacity and advocate for patients' rights to make informed choices about their treatment, even if those choices involve refusing treatment. Confidentiality, another cornerstone of ethical practice, involves protecting the privacy of patients by ensuring that their health information is kept confidential.
Mental health nurses are ethically and legally bound to maintain confidentiality, disclosing information only with the patient's consent or when required by law, such as in cases of suspected child or elder abuse, or when a patient poses an imminent danger to themselves or others. Beneficence, the principle of acting in the best interests of the patient, guides nurses in providing care that promotes the well-being of their patients.
This principle requires nurses to use their knowledge and skills to benefit their patients, avoiding any actions that could cause harm. In mental health nursing, beneficence often involves advocating for patients' rights, connecting them with resources, and promoting their recovery and overall well-being.
Navigating the ethical and legal complexities of mental health nursing requires a strong moral compass, a deep understanding of relevant laws and regulations, and a commitment to seeking guidance from ethical committees, supervisors, or legal experts when faced with challenging situations. At the heart of nursing lies the unwavering commitment to patient-centered care. This philosophy places the patient at the center of all care decisions.
In mental health nursing, patient-centered care is the foundation of trust and recovery. Respect for the patient's experiences and values is fundamental.
Mental health nurses approach each patient as a unique individual. This fosters understanding, validation, and empowerment.
Effective communication involves clear, empathetic information and active listening. In mental health nursing, communication extends beyond words.
Collaboration involves working with patients, families, and professionals. Mental health nurses actively involve patients in decision-making.
Patient-centered care extends to advocacy for patients' rights and social justice. Nurses advocate for policies promoting mental health equity and reducing stigma.
Section 5. The Art and Science of Mental Health Nursing. Mental health nursing is a delicate dance between art and science. It requires scientific knowledge, clinical expertise, compassion, and empathy. Science provides the foundation, but the art lies in human connection. The true essence of mental health nursing shines through in compassionate touch and empathetic listening. It is a testament to the resilience of the human spirit and the capacity for healing. Section 1. The synergy of teamwork in mental health. Mental health care thrives on the synergy of teamwork. Interdisciplinary collaboration brings together diverse perspectives and skills for holistic, patient-centered care.
This approach recognizes that no single discipline holds all the answers.
Imagine a mental health team caring for a patient with severe depression. The psychiatrist assesses medication suitability. The psychiatric nurse provides emotional support and monitors side effects. The social worker connects the patient with community resources. The occupational therapist helps identify meaningful activities. The psychologist provides individual therapy. The team communicates regularly to ensure coordinated care. Teamwork extends to pharmacists, dietitians, and other allied health professionals. This holistic approach addresses multifaceted needs through teamwork. Section 2. Communication, the lifeblood of collaboration. Communication, the lifeblood of any successful team, pulses through the veins of interdisciplinary mental health care, connecting diverse perspectives, fostering shared understanding, and ensuring coordinated action. Effective communication in this context transcends the mere exchange of information. It requires active listening, empathy, respect for different viewpoints, and a willingness to engage in open and honest dialogue, even when perspectives differ.
Open and frequent communication among team members is paramount to providing seamless, patient-centered care. Regularly scheduled team meetings, whether face-to-face or virtual, provide a dedicated space for team members to share updates on patients' progress, discuss challenges, brainstorm solutions, and coordinate care plans. These meetings foster a sense of shared responsibility and accountability, ensuring that all team members are on the same page and working towards common goals.
Documentation, often considered the unsung hero of healthcare communication, plays a crucial role in interdisciplinary collaboration. Clear, concise, and timely documentation in the patient's medical record ensures that all team members have access to the most up-to-date information about the patient's condition, treatment plan, and progress. This shared understanding minimizes the risk of miscommunication, duplication of services, or conflicting interventions. Beyond formal channels of communication, informal interactions such as hallway conversations, brief consultations, or shared meals provide valuable opportunities for team members to connect on a personal level, build rapport, and foster a sense of camaraderie. These informal exchanges often lead to creative problem-solving as team members share insights, experiences, and perspectives that might not otherwise emerge in more formal settings. Effective communication in interdisciplinary mental health care requires a conscious effort to foster a culture of respect, open-mindedness, and collaborative spirit. When team members feel heard, valued, and respected, they are more likely to share their expertise openly, engage in constructive dialogue, and work together effectively to provide the best possible care for their patients.
Interdisciplinary collaboration, for all its merits, is not without its challenges.
Role ambiguity can lead to confusion and duplication of efforts.
Clear role delineation and open communication are essential.
Differences in professional cultures and communication styles can pose challenges.
Mutual respect and a willingness to learn are key to bridging cultural divides.
Ongoing communication and professional development foster patient-centered care. In healthcare, where discoveries emerge rapidly and new challenges arise, lifelong learning is imperative for mental health nurses. Initial training provides a foundation, but continuous growth is essential. Nurses must cultivate their minds, refining skills and staying updated. Lifelong learning ensures evidence-based care, maximizing recovery and well-being. The evolving healthcare landscape demands expanded knowledge and skills. Telehealth and patient-centered care require ongoing education. Embracing continuous learning fosters innovation and progress in mental health nursing. This commitment benefits nurses, the profession, and those affected by mental health challenges.
The journey of lifelong learning in mental health nursing unfolds along a multifaceted path, offering a diverse array of avenues for professional development.
Formal education provides a structured approach to professional development. Nurses might pursue specialized certifications or advanced degrees, enhancing their expertise and expanding their career opportunities.
Continuing education courses provide targeted training on specific topics, keeping nurses abreast of the latest research findings and clinical guidelines.
Conferences and seminars offer valuable opportunities to network and learn from experts. Attending these events allows nurses to gain fresh perspectives and return with new ideas.
Mentorship pairs a less experienced nurse with a seasoned professional for guidance and support. Mentors share their knowledge and experiences, helping mentees navigate their careers.
Lifelong learning includes reading journals, listening to podcasts, and engaging in online discussions. Reflecting on one's practice is a valuable form of informal learning. Section 3. Cultivating a mindset of lifelong learning. Lifelong learning is a journey fueled by curiosity, a thirst for knowledge, and a commitment to growth. It's essential for mental health nurses to thrive, provide the best care, and expand their horizons. Embrace a growth mindset, believing abilities can be developed through dedication and hard work. View challenges as growth opportunities, setbacks as learning experiences, and feedback as a tool for improvement. Step outside comfort zones, ask questions, and seek help. Recognizing the pursuit of knowledge is ongoing. Curiosity ignites the flame of learning, essential for sustaining lifelong professional development. Approach work with wonder, asking why and how, to seek new information and challenge the status quo. View learning as an exciting adventure, enriching lives and enhancing practice. Self-reflection involves pausing to examine beliefs, assumptions, and practices. Identify areas for growth, acknowledge strengths, and develop strategies for continuous improvement. Regular self-reflection helps nurses stay grounded, maintain perspective, and align actions with values. Cultivating a mindset of lifelong learning requires effort, self-awareness, and embracing discomfort for growth. By nurturing curiosity, embracing a growth mindset, and engaging in self-reflection, mental health nurses can transform themselves and their profession. Section 1. The enduring impact of evidence-based mental health nursing. As we conclude this comprehensive exploration of evidence-based nursing practice in mental health, let us reflect on the profound and enduring impact this approach has on the lives of individuals, families, and communities touched by mental illness. Evidence-based practice, far from being an abstract concept confined to textbooks and research journals, finds its truest expression in the compassionate and skillful care provided by mental health nurses who are deeply committed to integrating the best available evidence with their clinical expertise and the unique preferences and values of their patients. Throughout this guide, we have journeyed through the multifaceted world of mental health nursing, delving into the foundational sciences that underpin this specialized area of practice, exploring the principles of research and evidence-based practice, and examining the ethical, legal, and patient-centered considerations that guide nursing actions. We have witnessed how the integration of scientific knowledge with compassion, empathy, and a deep respect for the individual patient forms the bedrock of exceptional mental health care. The impact of evidence-based mental health nursing extends far beyond the walls of hospitals and clinics, reaching into homes, schools, workplaces, and communities. It empowers individuals with mental illness to make informed decisions about their care, to actively participate in their treatment, and to advocate for their own needs. It strengthens families by providing them with the knowledge, skills, and support they need to navigate the challenges of mental illness and to support their loved ones on their journey to recovery. Evidence-based mental health nursing also plays a pivotal role in shaping public policy, advocating for increased funding for mental health services, promoting mental health awareness, and reducing the stigma often associated with mental illness. By grounding their practice in evidence and advocating for their patients' needs, mental health nurses contribute to a more just, compassionate, and equitable society, where individuals with mental illness are valued, respected, and supported to live full and meaningful lives. Section 2. A call to action. Embracing lifelong learning. The journey of a mental health nurse is not for the faint of heart, nor is it one that ends with the attainment of a degree or certification. It is a lifelong calling that demands unwavering dedication, a thirst for knowledge, and an unyielding commitment to professional growth and development. As we conclude this guide, let us heed the call to action that resonates throughout its pages. The call to embrace lifelong learning as an integral part of our professional identity and as a moral imperative in service to our patients. The field of mental health care is in a constant state of evolution, with new discoveries, treatments, and approaches emerging at a rapid pace. To remain at the forefront of our profession, to provide the most effective and compassionate care to our patients, and to contribute to the advancement of mental health knowledge, we must cultivate a mindset of continuous learning, embracing new information, challenging our assumptions, and refining our skills throughout our careers. Lifelong learning in mental health nursing takes many forms, from pursuing advanced degrees and certifications to attending conferences and workshops, from reading professional journals and engaging in online discussions with colleagues to simply reflecting on our own practice and seeking feedback from trusted mentors. It is not about accumulating credentials, but about cultivating a curious and engaged mind, a willingness to step outside our comfort zones, and a deep commitment to personal and professional growth. Embracing lifelong learning is not only essential for providing exceptional care to our patients, but also for our own well-being and professional fulfillment. It keeps us engaged, energized, and connected to the ever-evolving world of mental health care. It reminds us that the journey of a mental health nurse is one of continuous discovery, growth, and the profound satisfaction that comes from making a real difference in the lives of others. Section 3. Shaping the future of mental health care. As we stand at the forefront of the 21st century, the field of mental health care faces both unprecedented challenges and extraordinary opportunities. The rising prevalence of mental illness, the complex interplay of social determinants of health, and the persistent stigma surrounding mental health conditions demand innovative solutions, compassionate leadership, and a steadfast commitment to advancing knowledge and improving access to care for all. Mental health nurses, with their unique blend of scientific knowledge, clinical expertise, and unwavering compassion, are uniquely positioned to shape the future of mental health care. By embracing evidence-based practice, advocating for our patients' needs, and collaborating effectively with colleagues across disciplines, we can create a more just, equitable, and compassionate mental health care system that prioritizes prevention, early intervention, and recovery-oriented care. The future of mental health care hinges on our collective commitment to reducing stigma, increasing access to care, and promoting mental well-being as an integral part of overall health. It demands that we challenge outdated assumptions, embrace innovative approaches, and work tirelessly to create a society where individuals with mental illness feel supported, valued, and empowered to live full and meaningful lives. Let us, as mental health nurses, embrace this challenge with courage, compassion, and an unwavering belief in the transformative power of evidence-based care. Let us continue to learn, to grow, and to advocate for our patients, shaping a future where mental health is valued, understood, and supported, and where every individual has the opportunity to achieve optimal mental well-being.